Elmbank Group Practice is one of 27 practices in Aberdeen City. They have about 12,000 patients and their healthcare needs to look after. This is a typical day in the life of one of their GP partners and their colleagues in the practice. Chris Proven is one of the GP partners at Elmbank Group Practice. His day starts at 7 a.m. Each GP has many different roles to fulfill each day, not just seeing or speaking to their patients. As well as this, they need to review patient test results, hospital discharge letters, make clinical decisions about unwell patients, make referrals, dictate and type up clinical notes, and be the GP on hand to support their other clinical colleagues.
I'm here early to do my bloods, because all the blood test results come back from yesterday. Need to go through them, 30 or 40 of them, sort out which ones are something we need to do about today, urgently. We also, today, because I'm duty doctor, will have the out of hours from last night to look through, to make sure, again, we don't need to contact any patients who've had difficulties overnight. Also looking through the discharge letters from the hospital, and the pharmacist will check those discharge letters as well for medication to make sure that there's any changes. We sort that out for patients. So at 8 o'clock, the duty phone will be live, so patients may come through in that. 8:30, we'll start getting patients phoning in for our on-the-day appointments and for urgent requests to be seen today. Initially, we'll go through a telephone consultation with them, but if they need to, they'll come down and we'll see them face to face and examine them and take the problems step by step. So, big volume of work ahead, but looking forward to it. Patients are great. It's a great job. We'll just work through it as best we can.
Chris starts seeing his first patient of the day at 8:30 a.m.
You're coming back because you've had some problems with your heart and a few different things. How are you doing?
Well, the thing I'm most aware of is the problem of fluid retention and fluid disposal.
It's very important that GPs and other clinical staff provide continuity of care to their patients where they can. This helps build relationships and trust. It can also help lower avoidable hospital admissions, contribute to fewer urgent care visits, and create higher satisfaction among both patients and GPs. Patients who receive continuity of care in general practice have better health outcomes, higher satisfaction rates, and the healthcare they receive is known to be more cost effective.
I'm very pleased to be able to see you.
Yeah, because I mean, your situation, I think we do need to make sure that you get some sort of continuity of care.
Right,
so
I'm obviously potentially a problem, but I'm hoping not to be so.
No, in the sense of I hope we don't have to see you, because that means that you're well and thriving as much as possible.
Yeah, right.
As the duty doctor, Chris also has a responsibility of contacting patients whose test results need further investigation. This may be about discussing symptoms, medication, or asking the patient to come in for further examination or tests. Chris may also need to discuss medication with the pharmacy team and liaise with the community nurses or other colleagues when required.
Your blood test results, and one of your test results is raised, suggesting there may be a bit of an infection or inflammation in the system there. So I'm just wondering, how are you feeling?
Well, to be honest, I've not been feeling that great, so...
Queries and disruptions are regular throughout the day for the duty doctor. Chris needs to be able to respond quickly to problems and immediate concerns about patients and staffing levels to ensure that patient care is not compromised.
So I can see your screen there,
Yep.
and it looks quite full already. That's just from this morning. This is essentially what you would call a virtual waiting room, is it?
Yeah, that's an interesting way of putting it. It's a way of us dealing with the demand so that we can actually phone patients back and pick out the ones who we can deal with over the phone and see the ones face-to-face who need to be seen face-to-face.
The waiting room may not appear as busy as before due to the new ways of working, but what was once a physical waiting room has become a virtual one, where patients are triaged on their health priority needs and managed in a different way to ensure those in the most urgent need are seen as quickly as possible. Demand is busier than it's ever been.
Come in.
Hi, how are you?
Hi there.
Okay, we've got a couple of problems.
Okay.
Baby's phoned in sick.
Right.
A couple of patients sitting in reception. And the other thing is, that's us hit 40 contacts on the advice list. We've got no more appointments available to open for the rest of today, so we're going into afternoon.
The practice receives a large number of calls from patients each day. It can be frustrating for patients if they can't get through the first time. But with 12,000 patients on their list, it can be challenging for the team to keep up with the demand.
The most important thing for everybody here is that we're giving the service that the patients are needing. There's no point me sitting in my office thinking about the strategy of the business if we're needed here, if we're short-staffed in here. So if everybody's in and everybody's well, then I don't need to do this. We've got an excellent team who carry out this role brilliantly, but sometimes we are short-staffed, and then I'll come through. To be fair, it does me absolutely no harm to hear what's coming through in the phones, to hear what kind of things people are phoning up about, to hear how they're talking to the rest of the team so that we can make any changes to the service that we need to. Or I can step in and talk to the patients if they're not being appropriate in the way that they're talking to the team as well, which unfortunately some of them are not.
So asthma review today, Reese. Yeah, how's your asthma been?
The nursing team plays a vital role in looking after patients, and they are skilled in dealing with multiple healthcare needs, including asthma and respiratory health, heart health and blood pressure monitoring, diabetes, family planning, lifestyle management, as well as treating and dressing wounds. They also flag up any patients of concern to the GP for further review. Sometimes the patients attending the nurse need further investigation from the GP. This is where Chris steps in as the duty doctor to see the patient and offer further advice or treatment.
So let's have a good look if we can. You open up really wide for me. Excellent, that is really good. Okay.
The reception team and care navigators are there to help direct the patients to the right person at the right time with the right care. This ensures everyone who needs help can get it.
This practice would not run without the team here. This is the front of house. If we don't put the patients to the right person at the right time, then they're not going to get the help that they need. Yeah. So if we've got somebody who we can hear is possibly suicidal, who is possibly really struggling with their mental health, it's one of the team in here that will flag that to the doctor, and we will get them help. We will get them help probably within half an hour. Yeah. They save lives. You always think it's the doctors that save lives. And yes, they do. But the first people that do that are the reception team. Yeah. They are amazing.
I can hear the phones are ringing off.
Yes, we better go.
The practice has skilled pharmacists working as part of the team to provide a vital service to both the patients and the clinical staff. They undertake medicine reviews and support patients on complex medicine regimes. They monitor and issue thousands of prescriptions each week, as well as monitoring patients on long-term medications and also providing advice to staff and patients on medication queries. The practice would not be able to function without the support from the pharmacy team, as this helps free up time for the GPs to deal with more serious patient concerns.
Yeah, life looks different.
Yeah.
Life does look different. The way that, and we've had to make those changes, not just because of COVID. We've had to make those changes to get through the volume of work and make sure that we're giving the service that we need to. But it's thousands of prescriptions that go through every day. It is thousands of calls that come in. It is hundreds of patients that get seen. It's challenging in a completely different way, but it's more rewarding than anything else that I've done.
Chris has had a very busy day, and his work is not finished yet. It's 6 o'clock, and the practice is now closed for the day. But Chris still has some work to catch up on before he goes home. This happens often in general practice, and staying late is something the partners will do to ensure their patients are well looked after.
It's been an intense day, and there's still a few patients often that we have to actually phone up after that. Still some more work to be done, and then I've got referrals to do. Only a relatively small percentage of the patients that we see end up to be referred on to the hospital, probably less than 10%, but we've got to do the referrals. We've got to look through all the letters that come from the hospital. We look through to see if there's anything we need to do from them. And we have to do this now because we've been prioritising seeing the patients really all day. So those are the types of things, and also insurance reports, other things like that. So the administrative type of things. So we're trying to do that now.
So is it hard to fit that in within your sort of the times the practice is actually open?
It is. We do actually plan for and have administration time in some days, but not every day. When you're duty doctor, you don't have time to do these types of things, so you have to fit it in elsewhere because the demand is intense. But it's been an enjoyable day in many, it gives you a bit of a buzz doing all of these things and helping them, meeting people and people I've known for a while. But now the adrenaline is running out a bit. I mean, the highs probably are some of the patients and sorting them out and realising that you can help them with what's happening. Working a team, the laughter in the coffee room keeps us going. We really do work as a great team. The patients keep us going. So that's probably the highs and lows.
Yeah, and then it's all back tomorrow to start it all again.
Yes, you go home quite tired, and then you come in and do the same day over again to a certain extent. But that's what we do. But it grinds you down after a while, so you have to make sure you do take care of yourself and you don't get burnt out by these types of things, which can be challenging for many doctors.
It's 7 p.m. and Chris can finally pack up and go home after a busy 12-hour day in the practice. He's tired, but he'll be ready tomorrow to do it all again.